Well, it's certainly the question of the moment.
I mean, what on earth is going on at Manx Care?
Hi, I'm Siobhán Fletcher, and in this week's Island Life, we're going to be taking a special look at Manx Care and the cost-saving schemes that they're currently in the process of implementing. Over the course of the next half an hour, we're going to hear from ministers, politicians, the Isle of Man Medical Society and the Chief Executive of Manx Care, all of whom have been interviewed by myself or my colleagues over the last week. Now, today, Manx Care announced it's in the process of implementing an additional £5 million worth of savings schemes. If successful, the board say the measures will bring its overspend down to £8 million this financial year. However, several of the 11 schemes outlined impact patient-facing services, from the Ramsay Minor Injuries Unit to mental health contracts. But last week, we actually heard about one of those schemes first. The healthcare provider has come under fire over plans to reduce the number of elective operations it performs as a cost-cutting measure. The move is expected to last for up to 6 months. The healthcare provider is basically cutting the number of operations each week from 30 to 24.5 over the winter to try and reduce its overspending. It's something that's been critiqued fiercely by the Isle of Man Medical Society and politicians. And the decision came to light through a Tynwald written question submitted by Oncan MHK Julie Edge. Here she is speaking to our news editor, Sian Cowper.
What was your initial reaction to the response from the Health Minister?
Shock. I felt that, again, it's the people of the Isle of Man that are going to be impacted by this, and waiting lists are going to increase, because that's the only outcome of cancellations for which they've stated are selected within general surgery, ENT and gynaecology areas. So my concern for anybody with a health issue that they're waiting is now they're going to be waiting longer. And we've invested so many millions into reducing waiting lists in certain areas. Here we are we going to create another one? And then there'll be a call for, we need extra money, we've got a waiting list. So I find it quite alarming that services to our people are being reduced, but we've not seen any tangible reductions in any other areas which seem to be growing, and particularly reported by lots of people is management.
Now, following the publication of that article, we heard from the Isle of Man Medical Society, who said they only discovered the move was taking place via our reporting, with its last discussion with Manx Care on the topic having taken place on the 20th of September. I sat down with 2 members from the Society to find out their reaction to the news.
I'm Sean Crerand, and I'm one of the orthopaedic surgeons in Nobles Hospital.
And yourself?
My name is Prakash Tyagarajan. I'm a consultant pediatrician and neonatologist. I'm here in my role as the chairman of the Isle of Man Medical Society, and Mr. Crerand is the president-elect, taking office in 2 weeks' time.
And so, in response to this news coming to light, the Isle of Man Medical Society has issued this open letter, really. Well, it was addressed to the Manx Care Board, but you've made it public. So within that, you say that these cuts will have, quote, a severe and far-reaching consequences for patient care and the overall health of our community. Can you give me a little bit of insight into why that is?
If you reduce the number of operations or the frequency of our operations by 25%, which is the proposed cut, then what will happen is that patients will be waiting, inevitably they will be waiting longer for their surgery. And of course, the longer they're waiting, the more complicated their conditions get. So what might have been a relatively straightforward operation at the beginning could turn into be quite a complex operation.
We've just spent a lot of money reducing waiting lists, and it being a big deal made of we've reduced waiting lists. But what you're saying is we're just going to potentially add back to those waiting lists. And
absolutely.
But from your perspectives as surgeons, you're saying no, this will add to waiting lists in the long run.
It will add to it from 2 prongs. It'll add to it because we're doing less surgery, so people will be waiting longer, and it'll add to it because the idea is that during the periods when we would normally be operating, we will be doing outpatient clinics, and of course that's going to add, because if I see someone coming in who needs a hip replacement or a knee replacement or a shoulder operation or a foot operation, I'm going to add them to the list. But because my list has been cancelled, then they're going to invariably or inevitably wait longer. And also, I mean, we are our patients' advocates. We want to treat our patients, and a lot of these patients that will be affected by these cutbacks are elderly patients. They're in pain, and that is going to be prolonged really because of these cutbacks.
This all comes down to, they're talking about savings to do with, they say they've paid £84,000 per month in the first 4 months of the year, mostly on bank staff. And I think that's the key saving that they're trying to make here. But what do you think then is the incentive for, medical professionals to take a permanent role on the Isle of Man if they're getting paid that much more as bank staff?
The medical staff on permanent contracts haven't had a pay raise in 18 months. And we're actually probably for the first time falling behind UK by quite a considerable margin, about 12% behind England, NHS England, and about 20% behind Jersey, and about 15% behind Northern Ireland. And this is making the basic contracts very unattractive. So what we are doing is attracting people who almost like nomadic, doing mostly locum agency type of work, who have no commitment. They don't put roots down on the island. They fly in, fly out. And in many cases, I believe we pay for their flights and accommodation while they're here as well. And there is a huge variation, like you pointed out, in what they pay permanent staff versus what they pay agency staff.
What would you like to see the outcome of this conversation be?
As I said at the very beginning of this interview, we are our patients' advocate, and ideally we don't want to see lists being cut. I spent 14 years training to be an orthopaedic consultant, and I've spent 29 years here operating. It's such a waste of a very specialised personnel, so to speak. So ideally, I don't want to see, I want Manx Care to reconsider this, to look elsewhere, to come to and talk to us about other means of saving money, maybe, rather than cutting frontline services.
Obviously, I'm not an experienced hospital manager or director, but we are at the moment recruiting for the medical director, director of nursing, director of people, director of quality and safety. 4 jobs, all paying over 150,000 a year. Why not freeze that recruitment until the financial year is over? Then you'll save twice as much as the 220,000 that you were going to save. So do interventions that do not impact on the patients. They are the sole reason we're here.
Since then, we've heard from the Manx Labour Party, which is calling for a renewed look at tax reform. They say thresholds for higher earners have been left untouched, whilst workers bear an unequal burden. Leader of the party and Health and Social Care member Joni Farragher sat down with Lewis Foster.
We've seen Manx Care recently effectively saying that they're going to reduce elective surgery, and there's been a lot of narrative around how they have to balance the books. There's also been a lot of narrative from government that they are over budget, and it is our position that they are underfunded and that they have been for many years rather than over budget. And actually that is a position that's backed by the Sir Jonathan Michael report and the calculations that he gave for the funding formula that were approved by Tim Mould in 2019, along with the rest of Sir Jonathan Michael's recommendations, which included significant transformation and improvement work that Manx Care were tasked with delivering for the Manx public. But they weren't given the funding formula from when they were formed. So therefore, that's resulted in them being underfunded to the tune of millions, actually. And that is a narrative that does need to be more discussed and more widely known, actually.
And I suppose something the taxpayer will immediately think when they hear additional funding for Manx Care is, well, how much is that going to cost me extra? But you're talking about tax reform as well. How would that work in real terms?
So Manx Labour Party has always obviously stood for progressive taxation, which is a system in which the people with the broadest financial shoulders, the wealthiest people essentially, pay more than the poorest in our society. But there are also a lot of other ways that Treasury could look to raising additional revenue that they don't ever seem to look at. Capital gains, inheritance, raising the tax cap. There just does seem to be this very, very fixed mindset that the only way that we can raise revenue is by taxing workers. And that's created quite an imbalance on our island. And I think in the last budget, when the Treasury did add an additional 2% onto the highest tax band and didn't change thresholds, that has created quite an unfair situation, quite an unequal situation, essentially, for Manx workers. So we absolutely would not want to see Manx workers taxed anymore. I really do think we're at the limit there, and it would not be fair at all. It would not be equitable to put any more of the financial burden upon workers. But there are several ways that can be explored by Treasury, as I've already mentioned, and I really do think that this is the time that we need to start looking at additional sources of revenue. I mean, it's a difficult decision for people to make, and it could be, in my view, something that needs to go out to the Manx public. Do we want to retain a free at the point of use model, or do we want to actually start paying for our surgery when we go in for it? And that, that's very fundamental to our core values as Manx Labour Party. We believe that everybody should have access to health services, and in order to get that model working, we need to have the revenue behind it.
Since then, we've spoken to the Health and Social Care Minister Laurie Hooper and the Treasury Minister Alex Allinson to try to get to the bottom of the pressures facing Manx Care from the Council of Ministers.
I think, as I've explained already, has been reported by Manx Radio, whilst this is technically an operational decision made by Manx Care, it has come at the behest of those on high. So we've, as you've seen, publicly reported the Chief Minister has been quite clear that Manx Care has to come in on budget. I think his words were irrespective of demand. That's how it was reported. The Treasury Minister has also made his position very clear that we are required to enact what he calls our contingency plans. And ultimately, so like I say, whilst, yes, Manx Care's decision was made by them, it was made in that context of very clear messaging, very clear communications from those at the top of the tree. I don't think this is a decision that would have been made by Manx Care if they'd have been given any options around it, I think.
So what is your view?
I think my view is the same as Manx Care's. We've been told to do it, so it's being done. Like I said, it's not something that I think anyone would choose to do. I had a nice long conversation with some members of the Medical Society this morning, and you'll have seen their letter as well, saying that what they believe the consequences could be of these things. And actually, we've made that case as well to the Council of Ministers, where we've explained quite clearly that ultimately it's all about demand, and the demand doesn't go away simply because you decide not to address it today. Actually, the people that need these surgeries are still going to need these surgeries. So I say in a perfect world, I think Manx Care would have made very different decisions, but in the context that we have been placed in, with the very clear instructions and messaging that's coming out from the top, it's not like we have a lot of room left to manoeuvre.
I mean, Manx Care's CEO, Teresa Cope, says cutting elective surgery lists isn't unusual in hospitals elsewhere ahead of winter when there's greater demand for beds. So was this the best of worst option, if you like?
I think she's right when she says that, actually, and what you do tend to see is reactive cuts. So what will happen normally is if you have a spike in winter demand, then the service might decide not to run lists at short notice because they have to deal with the demand that's coming through the door. The reality is if you do it on a reactive basis, it doesn't save any money, but you still lose out on the surgery. So in some ways, this is a relatively standard bit of practice. But you can see the consequences of that across in the UK when they stop doing these things. You know what the end result is going to be. It shouldn't be a surprise to anyone.
Was it Treasury's decision to cut elective surgery?
No, it wasn't. I mean, in terms of the separation of responsibilities, Manx Care is responsible for using the budget it's given in the right way to ensure the proper and efficient provision of what are called mandated services. So earlier on this year, you remember that Tynwald agreed a mandate from the Department of Health and Social Care with what were the key priorities for Manx Care. And a lot of that was around primary care, expanding that, GP services, but also hospital care, and really concentrating on efficiencies, quality, and also safety. And so it is the responsibility of the Manx Care Board to use the money wisely, but we know that they've come under significant pressure. And yesterday we released the first government management accounts to show that several other departments are also coming under significant pressures in terms of their budgets.
Do you agree with the Chief Minister's comments that Manx Care must operate within its budget?
As Treasury Minister, it's the responsibility for me to balance the budget and come to Tynwald and to the country once a year to show where the taxpayers' money is being spent. I think it's the responsibility for all departments to come in on budget, but obviously we also appreciate that there are significant pressures on them in terms of the legacies of the high inflation we've had over the last 2 years, but also above inflation pay increases as well, which, for instance, in Manx Care are an additional risk of up to £4.5 million. So we do understand that, and we are doing as much as we can with all departments to give them the tools and the resources they need to try to come in on budget.
Now, since April, there has been the higher income tax rate that went up 2% in your budget in February, and that was meant to be ring-fenced for health. And now, with this elective surgery announcement, we're essentially seeing less from the health service than before that 2% increase came in. What are taxpayers actually getting out of that pay rise, the tax rise?
Yeah, you're very right. I mean, and it gave me no pleasure to have to put up income tax as a temporary measure while we looked at other funding streams for the health service. I mean, the Manx Care budget was an increase of £43.8 million. Part of that was the 2%, part of that was additional revenue. That's gone really towards the existing services, improving services, especially the quality and safety of services, which is something people often don't see if they walk into a GP surgery or walk into Nobles. But we know that with the CQC examination, there was a lot of money that needed to be invested to improve quality and safety. What we've had this week is the announcement by Manx Care that they are adjusting the way that they run the theatres. Actually, a lot of departments in the UK do this anyway as we approach the winter. They scale down some of their elective surgery to create capacity for winter pressures. But also Manx Care are going to be using those consultants to actually clear some of the other waiting lists, which are the waiting list for outpatient appointments. I think they've done this in a responsible manner. I know that it hasn't been popular, but they've been quite open about the reasons for this and the reasons why they need to do this.
So why did the board of Manx Care come to this decision, and how did we get to the point where patient-facing services are being impacted? I sat down with the chief executive of the organisation, Teresa Cope.
So at the start of the year, we knew that we needed to achieve around £19 million worth of savings overall in order to not overspend in this financial year, and we were very committed to do that. So we identified £19 million worth of savings, which was built up in a bottom-up way, working with our service teams in order to identify the savings for the organisation, as well as sort of a corporate overlay of what else can we do. So the board in April signed off £19 million worth of savings. Now, as we've gone through the year, we've had an increase in what we call our monthly run rate. So that's basically how much we spend every month. And that's been driven by the work that we send across to the UK, so our tertiary contracts, but also drug expenditure. And there's been a couple of very high cost placements, and all of that has essentially meant that we have overspent on our monthly run rate. In addition to that, of the £19 million worth of savings that we initially signed off at the start of the year, some of those haven't come to fruition. Some of those have been subject to impact assessments, which means they're too risky to go ahead. And so the board is now in a position where ultimately of that original £19 million worth of savings that we identified, 195 schemes, so a lot of individual schemes, around £12 million will be delivered in this financial year. Now that gives us a gap. So in July we started working in order to close that gap, and that meant going back over some of the more unpalatable decisions and taking a closer look at where we can make those savings. And as a result of that, £4.8 million worth of additional savings were identified and signed off by the Manx Care Board in September for implementation. And the elective cooling programme is one of those. So of that 4.8, approximately £3 million of that are savings which are not around frontline delivery and would have minimal, in fact no impact on patients. But in order to close that financial gap, we've had to take the really difficult decision as a board to implement some schemes which we know will have a minor impact on patients. And we assess that, and that elective cooling programme, it's an unpalatable decision, and we know the impact it will have. So, in lots of respects, the Manx Care Board and the Manx Care executive team agree with the position put forward by those two consultants who spoke this morning. It's not a position we would want to progress, but ultimately we have a commitment as a board to reach financial balance, and therefore these decisions are necessary.
Can you see the struggle the public have trying to almost, you said it was unpalatable, it's unpalatable for them as well?
Absolutely. Yeah, no, none of this is easy. Absolutely none of this is easy. A couple of things. I mean, as a statutory board, we cannot function without a chief nurse who has accountability for the nursing workforce professionally. And the same is true of the medical director. We cannot function statutorily without having an executive medical director. And those are the two posts that I think are being referenced. We're also out to recruit to a people director. But again, it's unlikely that appointment will hit before the next financial year. But I do absolutely, take the point around us needing to show transparency and demonstrate equal scrutiny on non-frontline services. The only other thing that I would say with regards to elective activity, and this is routine planned activity, and we do understand there is still an impact for patients, but as we go into winter, most hospitals choose to reduce their elective programme because they will need the beds for the increased numbers of medical patients that are likely to come into hospital during the winter period. We have a very small bed base here on the island, and we have to work incredibly hard not to have delays in admissions, and we work at a very high level of bed occupancy. Now, what that means is often we have been in a position of having to cancel surgery electively in order to make room for our non-elective admissions. So doing that in an unplanned way, i.e. just cancelling people on the day, is often the worst way. It means that you waste a lot of resource, and it also is detrimental to patients in terms of that cancellation and having to rebook.
You've just spent an awful lot of money reducing waiting lists. That's been a big thing for Manx Care. When you're weighing up a decision like this, how can you justify that increase in waiting lists then after trying to bring them down so much?
Yeah, and I know this comes across as sort of a decision which doesn't seem to stack up against the wider restoration recovery. That got us down to sustainable waiting list levels and treated several thousands of patients and was a huge success. What we're talking about here is across sort of 4 specialties, a short-term measure which would impact a maximum of 100 people. What we do know is that our outpatient waiting times are very high, and that's where we would want our clinicians to focus their efforts in place of doing theatre. We know this isn't a long-term fix, and we don't want it to be a long-term fix, but in the short term, it's one of those necessary decisions that we've had to make.
These elective surgeries essentially comes down to not being an emergency at the time. What about if they're waiting on that list and the issue gets worse while they're waiting, and then that's a more complex and potentially expensive surgery down the line?
We wouldn't get to that point. So, for example, if we needed an extra list to go in on a week because somebody needed the surgery that week, their clinical presentation had changed, or it was a time-critical surgery, the list would go back in. It's because on the basis and the modelling that we've done at the moment, those lists are being booked with routine patients. But ultimately, if we need 2 more lists of those 5 going back in order to make sure, say, a cancer patient or a patient who needs time-critical surgery, those lists would go back in because the cost-benefit analysis of that would absolutely demonstrate we need to put those back on.
Alfred Cannon and Coleman have made their position clear. I mean, jumping back to February when the budget was announced, they said that Manx Care would have to be within its financial budget for the year, hence why you're having to make these savings. And as recently last week, he said that Manx Care must operate within its given budget, irrespective of the demands on the service.
There has to be some financial control applied to our health system. The arguments about whether it is underfunded are not. They need to be looked at in the medium to longer term. But whatever the case, the department, the healthcare system must operate to the budgets it is given. It was given an extra £43 million in last year's budget, and part of that revenue call went in greater scale to the taxpayers who were asked to pay an extra 10%. We're looking at a £16 million overspend, which must come down, because otherwise, without financial control, you have to question whether how much money you give the health system, whether it will ever be able to run within a set budget.
Is this measure here something of a bit of a political football for Manx Care? Do you know that this is going to be unpopular with the public and therefore make the move with almost a hope of provoking politicians into action?
Absolutely not. And that is a disappointment that is even a perception. We are all professionals. The board operate with a high degree of professional integrity. I'm a clinician, as are many other people on the board. So this absolutely isn't used as a political football. There are over 195 saving schemes running concurrently in Manx Care to help deliver those £19 million worth of savings that we need to do. We are all very careful to choose the schemes that will ultimately have the least impact. And it is disappointing when that's levelled, and it's disappointing when that comes from politicians. I've taken the opportunity to brief politicians on this. There is a responsibility on us all to make the best decisions and to do that responsibly and to not alarm the public. And we take that role very, very seriously.
Now, as I mentioned at the top of this programme, since all these interviews were conducted, Manx Care has announced a further series of cost-cutting measures. All the details you need about the various schemes are at our website, and there's another full interview with Theresa Cope via our newscasts. Manx Care told us that the remaining £8 million of overspend they're predicting for this year is a matter still up for discussion between them and the Department of Health and Social Care. So will they bring the books into balance this year, or will they get more funding in the next financial year? All that will be revealed as we go. And as always, we welcome your comment on these issues. I'm Siobhán Fletcher. Thank you so much for listening. And as always, those interviews in full are available via our newscast.